Good morning, everybody. Hope you are doing well. It's Monday, and I am so excited to start the week with you. My name is Dr. Lindsay Ogle, and I am a board-certified family medicine and obesity medicine physician. And I am so excited to introduce you to my very new YouTube channel. I am so excited to share my knowledge and experience with many more people than I'm able to in just my primary care practice and in my clinic. And what I want to share with you is kind of my approach to taking care of patients. My thought process and my philosophy is to help patients be the happiest and healthiest version of themselves so they can live the lives that they truly desire. It's my pleasure and privilege to meet with so many patients and be entrusted to help them live their happiest and healthiest lives possible. I am able to accomplish this by focusing on prevention, lifestyle, and evidence-based practices for effective and helpful treatment. I wanted my first video to be 3 reasons why you need your own primary care provider, or what we sometimes call your own PCP. PCP stands for primary care provider or primary care physician. So reason number 1 is that you can get your annual wellness visit. And I'm going to do individual videos about what that would look like for my female patients or my male patients, and we'll go step by step what to expect during those visits. Or some highlights for now is that your provider or your doctor would go through any age-appropriate or age-recommended cancer screenings that you would need to make sure that you are up to date on. They'll also go through your vaccine history and recommend vaccines for you. They'll check your blood pressure and weight and height. They'll check all of your vitals, specifically your blood pressure, making sure that that's in a normal and healthy range. They will ask you lots of questions about your health from the past and the present. They may talk to you about habits such as diet, exercise, and smoking, alcohol use, and other drug use. If you're a female, they will talk about birth control and whether that is something that you are interested in and the options available to you. They will probably do blood work, and I will have a whole video about screening labs, the most common labs that are done during wellness visits, and we'll go over what each of those are and what the numbers mean. And if there's time, you'll have a chance to address any other concerns that you have, whether that's for chronic conditions or new symptoms that have developed. Reason number 2 that it would be great for you to have your own primary care doctor is that they can help manage your chronic conditions. So primary care doctors can manage so many things for you. They can manage high blood pressure, high cholesterol, diabetes, asthma, or COPD. They can also help with anxiety or depression. They can help with acid reflux, stomach concerns, IBS. They can help with osteoporosis. They can help with addiction. They're able to manage chronic kidney disease, headaches and migraine, osteoarthritis, chronic pain, and even complicated conditions like heart failure or liver disease. Third reason why you should have your own primary care provider or PCP is that they can help you when problems arise. When you need an urgent visit, you can go and talk to your primary care doctor instead of having to go to an urgent care or the emergency room. So primary care doctors can help with things like a new rash that's popped up, UTIs. They can help with colds and upper respiratory infections, COVID-19, flu. They can help with pneumonia. They can help with stomach concerns that pop up like nausea, vomiting, diarrhea. And they can help with acute pain and acute injuries. If you twisted your ankle or you have injury to your finger, we can help you with that. If you have an exacerbation of one of your chronic conditions like asthma or COPD, we can help with that. So you can call your primary care office and get an appointment to be seen for these things. And that's the exciting bonus of having a primary care doctor, is that when things come up, you can go and talk to a doctor who knows you. You don't have to see somebody and start from the very beginning of your medical history. You can go and talk to somebody who really knows you and knows what would be the best treatment for you. For all of these reasons, I highly recommend, if you do not already have a primary care doctor, to look in your area and find one who you can establish with. And if you already have a primary care doctor, I recommend that you make sure that you have seen them within the last 3 years, because if you go 3 years without seeing your primary care doctor, then you'll be considered a new patient. And sometimes the office is no longer accepting new patients and you may need to find somebody else. So it's really important to go at least every 3 years, but we typically recommend seeing your primary care doctor at least once a year. Thank you so much for joining me on my first YouTube video, and I look forward to many more. I will be uploading a new video every Monday morning, and next we are going to go over what a wellness visit will look like. I will do one for the females and one for the males, and so you will know what to expect on your wellness visit with your primary care doctor. Have a beautiful day and a great rest of your week, and I'll see you next week.